For most first-time parents, getting the news that you're expecting is exciting.
I'll be honest, I was slightly terrified at first.
As the countdown to delivery day drew near, the couple had planned for a dinner date to celebrate their expected arrival.
The day before when he got sick, I still really wasn't even thinking about it. I was just like, oh, he thinks he has bronchitis. He probably has bronchitis.
John Eric quickly went to get tested to make sure that he didn't have COVID so he could attend the birth the next day.
7 minutes later, he said, "I'm sorry, but you've tested positive for COVID-19."
Now, Jordan needed to be tested to be sure she didn't have the virus as well.
I got tested the day before I went in on that Tuesday, and I was still negative. They treated me as a person under investigation since he was positive. And then Wednesday evening, I developed a sore throat and was kind of stopped up and ended up testing positive Friday, the day we left.
Jordan and Olivia went to her parents' house to quarantine in the basement with her mom, Amy, while John Eric remained quarantined separately.
And they have a glass door in their basement, and that's how he met Olivia, is through the glass door. And he would come pretty much every day.
Yeah, I came every day.
And we'd sit and talk through the glass door. And
that was one of the hardest things, was being able to see her, but not to be able to hold her or be close to her. So when they came in the house, I was like, okay, you do what you need to do, and then I'm laying on the couch with her the rest of the night.
Yeah.
Just get settled and then give her to me.
And joining us now is Dr. Anna Miller-Fitzwater, a pediatrician with Wake Forest Baptist Health and who helped oversaw this delivery. Thank you for joining us today.
Thank you for having me.
So you've got a soon-to-be dad who tests positive for COVID-19. You've got to assume the soon-to-be mother has been exposed as well. What goes into preparing for this delivery?
I think the most important word here is coordination. So the whole team came together to coordinate Ms. Johnson's care, and it was individualized. We know that people that have COVID-19 are actually infectious before they start showing symptoms. And that's why we had to consider her to have COVID-19, even though her test was negative. And the reason we want to do that is to protect Miss Olivia Rose, to make sure that she's safe and well, and then to protect our other patients by keeping our staff safe and healthy as well.
And so in general, how complex, how complicated have deliveries been the past 10, 11 months of this pandemic?
Sure. I think, honestly, the delivery itself has been pretty similar to the delivery experience for families, aside from the fact that visitors may be different and restricted, as in this case, and all of your care providers are wearing different types of gear that you may not be used to seeing. Where the complexity is keeping all of that coordinated and coming up with the processes to keep everyone safe. When we started the pandemic, we had very little information on the exact coronavirus that we were dealing with. However, we had information from other viruses. We met actually daily to follow new data that came out and revise our protocols, and had to learn how to communicate those to the whole birth center staff to keep everyone safe and healthy. So it required a lot of coordination for the processes, but the actual medical care, that's really still the same.
And you mentioned limited visitations, not as many family allowed in the room. Has that taken away any of the joy of the delivery process?
I think it's made it complicated. It was really hard to make that decision to say that if your support person has tested positive for COVID-19, that we should not allow them in the delivery. That was a very hard decision to make, but we're trying to keep mothers and babies safe. So we try to make accommodations where we can. We allow other support visitors there, and we try to do telecommunications as much as possible. So we try our best to balance those risks and benefits.
So what do we know about being pregnant and testing positive for COVID-19, or even giving birth while positive for COVID-19? Do we know if that affects the child at all?
Sure. So, I think pregnant women are at slightly increased risk, likely, for having adverse outcomes with COVID-19, but that risk is actually quite small. And the risk to the baby, going into this, we really didn't know what it may look like, but everything that's came back has been very, what I consider to be positive. The risk of transmitting COVID to your baby while you're still pregnant is very, very low. There's a national registry that we follow with nearly 7,000 mother-infant dyads at this point, and the risk is less than 2% during pregnancy to transfer this to the baby. The higher risk is actually after delivery. So that's why we make sure that we are practicing good infection prevention techniques with the mother and the child. So wearing masks, washing your hands. We want you to breastfeed, but wear your mask and wash your hands. And if you can, have a support person that's healthy that can keep your baby about 6 feet away from you as much as possible. We do not mask the babies, of course, but the mother or caregiver that's positive should wear a mask at all times.
And a new study released this month showed that pregnant women can pass COVID-19 antibodies to newborns. What's the significance of that?
Well, I think, this is early, but that's extremely, promising data. So again, more good news for babies during this pandemic. That study came out of the Children's Hospital of Philadelphia, and we know that with other illnesses such as the flu, if you vaccinate mothers during pregnancy or if they get the flu, they pass antibodies to their babies that help protect their babies for the first 6 months until they too can be vaccinated. And by showing that antibodies do cross, again, this is very preliminary, so we have to repeat these studies, but that does give us hope that perhaps we can transfer immunity, to babies through moms if we can vaccinate them or if they get the illness to help protect babies. So I'm taking that as a very encouraging study, and it's very preliminary, but it's good news.
And good news that the Johnsons were able to have a good ending to their story. Dr. Anna Miller-Fitzwater, thanks for joining us today.
Thank you so much.